Melissa Gordon, and I'm with the Department of Grants and Community Programs, and I want to thank you all for coming this afternoon for the Analysis of Impediments to Fair Housing Choice study. With me today is Christopher Plummer, who is a consultant with Ask Development Solutions out of Michigan. The city issued a request for proposals several months ago, and Ask Development Solutions was the winning proposer. They have experience in conducting analyses of impediments to fair housing in communities across the country, and we're very excited to be working with them on this. We are conducting this study because it is a requirement for cities that receive entitlement cities through the Community Development Block Grant Program or CDBG program, and participating jurisdictions through the HOME program. We conduct a study every 5 years and do updates in between. The last update was conducted in 2010, and the last full study was in 2006. Christopher has been in town since yesterday and will also be in town tomorrow. He's conducting interviews, one-on-one interviews with folks. He's also doing focus groups. He will be doing this public meeting, and he is examining our zoning laws and regulations and a number of other things which he will tell you more about. So I've introduced him, and he would like to know who's present here today. This is televised, so we need to use the microphone. So I'm just going to walk around with the microphone. If you could just let Christopher know your name and the organization that you're with.
Thank you for coming, Christopher. My name is Jean Hart. I'm a grants administrator with Missoula County.
Hi, I'm Nancy Hart. I'm with the Department of Grants and Community Programs.
And I'm Patty Hart, just kidding. It's Patty Kent with the Western Montana Mental Health Center.
I'm John Firehammer. I'm here with the Montana Tobacco Use Prevention Program.
Travis Hoffman with Summit Independent Living Center.
Justice Ender, Summit Independent Living Center.
Candace Day, Union Gospel Mission, Missoula.
Eileen Sansom, Missoula Aging Services.
Cindy Wolfcole, Grants and Community Programs.
Michael Moore, Reaching Home, Missoula's 10-year plan to end homelessness.
Melissa Richards with the YWCA.
Kayla Warren with the Missoula City County Health Department.
Autumn Schwenk with the Joseph Residence Program.
And Catherine Brady with the ASUM Off-Campus Renter Center.
Thank you. And I should add that Christopher will be compiling all the information from his research and from meeting with folks, and there will be a draft plan released at the end of this year, and there will be a 30-day public comment period, so you will all have the opportunity to look at the plan and to make comments on it before a final draft is released. And here's Christopher.
Check, yeah. Thank you. Thank you for having me here. This is my first trip to Montana and first time in a while seeing mountains. I'm originally from Jamaica, where there's lots of mountains, none with snow caps on them, of course, but mountains nonetheless. Moved here to Florida, and then my wife decided that she wanted to see the seasons, so we moved in 2006 to Michigan, Southfield. So, and here is a little bit colder than Michigan at this point in time, anyway. But I'm glad for the opportunity to be here with you. And the intent of this meeting is informational, but the bigger intent is really to get your input. Some of the things we're going to discuss here today are challenging, and we have been searching for solutions from time memorial, and it has been difficult. I mean, we had a focus group really of one today, which was good, but it highlighted that the issues aren't easy to deal with, and they are not black and white, and sometimes this work can get adversarial, but the intent is really, how do we solve this problem that we all have, and that of fair and accessible housing for all persons. How do we solve that? And so I'm going to be speaking, doing a presentation, but then I also am depending on you, although I am told that my Jamaican accent sounds nice and people like it. I don't want to talk as much, so I really am going to need to get a lot of your input in this process. So first of all, I want to talk to you about what is the analysis of impediment to fair housing choice. And in short, it is one of the certifications that the city needs to sign. It has to be signed by the elected official, which is the mayor. And the city is required to certify that it will affirmatively further fair housing. And how will the city do this? It will analyze and identify any impediments to housing choice within both the public sector and the private sector. And it is through the analysis of impediments, or AI as we call it, that will be achieved. As part of the AI, we are also required to identify any appropriate actions and recommendations that will be taken to address any impediments that will be found, and then to maintain records reflecting what was done to address those impediments. Now, the framework for this is the Fair Housing Act, which prohibits discrimination in any housing-related transaction, rental, sale of homes, provision of financing instruments based on someone's membership in what HUD calls the protected classes: race, sex, color, religion, national origin, disability, or familial status. In addition, HUD says that if the state or the city adds additional protected classes, then we have to include this in our analysis. The state has added marital status, creed, political ideas, and age. And the City of Missoula has added ancestry, sexual orientation, and gender identity or expression. So we are including those in our analysis. As we mentioned before, because the city receives CDBG and home funds, which I'm assuming, are you all familiar with CDBG and the home program? Okay. The city is required to do this. So what does HUD define as impediments? Impediments are any actions, omissions, or decisions that are taken because of someone's membership in all the protected classes that we mentioned before. And by those actions, omissions, or decisions, it results in restricting fair housing choice, somebody's right to choose, to be able to choose housing, and the availability and access to housing, or availability of housing choices. And then there's another set of impediments that are those that we would call the sins of, in some cases maybe the sin of non-intent. In other words, the intent was not when whatever decision was taken, or whatever action or mission was ensued, the intent was not to discriminate or restrict housing choice or restrict the availability of housing, but it ended up having that effect anyway, even though that was not the intent. So and those are generally around the issue of land use regulations, zoning, and those types of things. And we look into examples of this. The process that we will take is that we will look at factual data, demographics, housing market. We'll look at land use regulations of the city, zoning. How does the city define family? We look at group homes. Where are affordable housing developments cited? We look at education and awareness on fair housing. We look at the percentage of loans, application to loan denials across the city, and is there a pattern where in some areas or some populations there is a higher rate of denial than in some other populations. We look at any legal cases, any complaints that have been received by the federal government, by any fair housing agencies that process these cases. We look at public education, and we'll look at if there's any testing data regarding fair housing in the city. As I said, every 5 years this is done. One was done in 2006, and it was updated in 2010. So we're going to look at those impediments that were identified back then and what actions have been taken, how much money has the city invested in it, what activities have ensued, and whether or not those impediments identified in 2006 or in 2010 are still impediments, or have they been addressed? And is there any updated recommendations that can be included in that? We're also required to maximize participation in this process. So this is why we have been having meetings, focus groups. We have an online survey for residents, and we actually have hard copies of them if you want to fill one out, or if you haven't gone online, if you want to fill one out, hard copy, you can do it before you leave. Don't be daunted by the number of pages. When you go online, you don't see the number of pages, so it seems, when you look at the page, it seems like it would take a longer time, but it is actually a very short survey, comparatively speaking. So we have that. We also have surveys for realtors, lenders, housing providers, because we want to not just look at demographic data, but we want your feedback. What do you see as the issues that the data may not indicate? And in terms of solutions, yes, there are some tried and true best practices that we will include, but we also, there are many good ideas coming from you as the public and stakeholders in addressing this issue. And we have actually had some very good feedback so far. The survey went out maybe 3 weeks ago, and to date we have had about 38 responses, which is very good. I mean, I've done some of these where you had over 2 months, 72 responses. I mean, you are way past the half mark in just 3 weeks. So we're hoping that, and we're going to be putting the survey out. So we're hoping to get much more representative responses from you. On the slide, we just have some example of what is considered housing discrimination, some of them very obvious. Different rules for persons with disability, somebody being shown houses only in certain neighborhoods, someone refusing to sell or rent, We also have, the existence of planning and zoning regulations that limit the choices of certain groups to secure decent housing. My understanding is that the city has a definition of group homes that makes it a residential zoning. Most places have done this. A group home is considered a business, so they put restrictions on how many of them. You can't have the distance between them has to be half a mile, so it restricts that type of housing for that group of people. So those are some of the things we look at. We look at lending, as I mentioned before, and making reasonable accommodations for persons. And these are just some legal cases recently, not in Missoula specifically, but just some examples of legal cases that have had to be mitigated. The case of a landlord asking for an insurance policy and a doctor's note for a person who is autistic, or else they won't rent housing to them. And persons being discriminated against because it's a mixed couple, Caucasian and Mexican American, and a public utility discriminating based on national origin, having a different set of deposit requirements for a certain group of people. So these are just some examples of some of the legal cases. And we have here what are some of the impediments. Lack of awareness and education is a very big one. In our surveys, what we have found is that a majority of persons sometimes are not aware that they are being discriminated against. There are some obvious ones. Race is an obvious one. Familial status is not as obvious. Disability is not as obvious. I just had a meeting with the Housing Authority, and they said the majority of questions they get from landlords under the Section 8 voucher program is are related to persons with disability. They're not sure, do I need to make this accommodation? Do I need to provide a parking space? Or should the person wait their turn? So there's a lack of education and awareness on fair housing. Affordability is an impediment, not because in and of itself affordability is an impediment, but affordability of housing has the most impact on persons within the protected classes. Age, as it stands for the state, persons with disability, familial status, single parent-headed household with children, minorities, and it goes on. And then accessibility for housing, finding housing for persons with disabilities, and making modifications. And how do you ensure that there is what is called universal design in new housing, so that you are able to make modifications as people age in place and so on. And those are examples. So any questions at this point? Any questions, any thoughts, any comments, any feedback?
I just want to mention that Chris had referred to the survey. We do have it in paper copy, but if you want to find it, it's also on the City of Missoula webpage, it's on the Missoula County webpage, and it's also on the Missoula City Facebook page.
Okay. You have it? Okay.
Why not? What I see from the mental health point of things is that affordability has a clear de facto impact on persons with disabilities simply because they have less income. And we have a very low vacancy rate here. Housing is in high demand, and affordability for those at 20 to 30 or 40% of median income, and even below 50% of median income, is almost non-existent. So our folks rely on different types of vouchers or housing that has been built specifically for them. I guess I would be curious to know, many, many years ago in California, there was a statute that said each community had to provide their fair share of affordable housing. Have you seen any other regulations like this imposed from the state down that might help communities say, all right, we need to buckle up and look at some different solutions? Because right now, really, this city is very cooperative. They do everything they can, but there's a limit to what we can do with the funds that are out there.
Off the top of my head, I'm not thinking of anything that is actually imposed from the state, though many states develop affordable housing trust funds. I don't know if at this point I don't know if Montana has one. I know I worked in Florida in city government. Florida had one where in the boom times they had an affordable housing trust fund. The county I worked for at the time used to get $8 million a year, and this funding was available to persons up to 120% of the area median income. But of course, like with any trust fund, the legislature decided that they were going to raid it and use it for other purposes, non-housing purposes. So I think right now, the same county, because I was the vice chair of the commission that received that, I think there's a little left, and they may get somewhere close to 400,000 right now. But those are some state-run programs. You do have the low-income housing tax credit program, which is highly competitive in a lot of places. I don't know is there a minimum number of units in Montana to be competitive for the low-income housing tax credits?
Low-income housing tax credits, to answer your question specifically, I'm not the best person to do that. But without a voucher, they're typically not affordable to folks under 40% of median, even 50%. So really my interest is HUD can yield a hammer, and perhaps one of those hammers needs to be looking at things like provide your fair share of affordable housing based on your demographic, and whether that's tool is a housing trust fund, fair share of affordable housing regulations. I mean, you have some power. Maybe you could yield it.
Yeah. That's a good suggestion, but there are also some municipalities that use the same housing trust funds, but now more in terms of something called inclusionary zoning that says that for every market rate housing development you do, you could get density bonuses. You increase the number of units you can put in that area if some of the units are for affordable housing. But if not, you have to donate $1,000 per unit or $10,000 per unit that goes into a trust fund that can be used to build affordable housing elsewhere. But again, some of these solutions take political will. It's going to be your city fathers that will have to make that call to do that. But it works in some places, and I've known several cities where any high-end development you do, for every unit you have to donate an amount into a trust fund. So those are some of the. Okay. Any challenges you have as stakeholders trying to identify housing for the people who you work with, or even just for yourself?
So we work a lot with people with disabilities, and I think some of the main barriers that we hear are landlords and property managers not very knowledgeable on the Fair Housing Act when it comes to providing reasonable accommodations or reasonable modifications, and who's responsible for doing those. Or with parking at a multifamily complex thing, stuff like that. But I also, it's probably better than it is now. But when they go to build apartment complexes, multifamily, the builders and the architects being knowledgeable in the Fair Housing Act and what's required for at least ground floor units for complexes of 4 or more. I think that is an area that could be improved when it comes to building in accessibility and not having to go through extensive renovations when it is required.
Thank you. Any suggestions in terms of even that process? I know in some cities, if a developer is going to do a major development that impacts a neighborhood, generally they do community meetings, and they get input from the community in terms of even design of the units in some cases. Or do you have that type of process occurring with development? Those of you who have done, how many of you have done or participated in any kind of affordable housing development? Okay. Do you have, community input meetings where something like what the gentleman mentioned can be?
I think, sorry? Lynchings, yes, community lynchings. Yeah, generally when we show up and say the mentally ill are coming to your neighborhood, even though they're already there, that we try not to take that route. So quite frankly, I typically will purchase property for our developments in areas where we're properly zoned. There is no discretionary decision involved. We do have community meetings when they are required by home and CDBG. And we do have community meetings when their government has imposed a conditional use permit, for example, or whatever. But we also do things that are very small. There are other organizations who aren't here that make a huge effort to bring in the neighborhood and involve them in those discussions on planning and design. But we're not, the model that you're referring to is very typical of larger, more urban areas. We don't have a lot of subdivision that goes on that would trigger a number of public meetings before the local governments. We're really a funny size. And so impact fees or exclusionary zoning, or if you're going to develop for every 10 units at market rate, you're going to pay this much into a fund. We don't have the economies of scale and the will to really make those things work, in my opinion. Whereas in many other places they do, but we're still basically quite rural. But I also think that the point being really that if we have a building code that says everything on the first floor needs to be accessible or adaptable, I would just make sure that our city is enforcing that. And I think that they do. That's been my experience. But I would hand it back to the city to say that really needs to be a piece on the checklist of any final certificate of occupancy, is have they complied with those accessibility or readily adaptable building code requirements. I think it's a type 1 unit for every ground floor unit. And that's something that I think would be pretty easy for us to do.
Yeah. Thank you. Did you have a?
One thought that I had was how the city has taken part in accessibility. And we've had some meetings, even through the University of Montana, where uniform accessibility became a standard for the city, which it hadn't been before. So that when new units were built, they at least had that adaptability built into them in case in the future an individual handicapped or would need a ramp built or certain access to different parts of the building.
Okay, thank you. Just to go back to Patty's point that I'm working with a city where met with the director of the planning, zoning, and building, and they do have some provisions to make sure that there are accessibility components in the buildings. The problem is that he readily admitted at the time that, hey, I need to check to make sure my inspectors are inspecting those components to make sure that they are in place, because some of them are not so obvious. You know, some of them may be the width of the doorway. Did somebody actually physically measure it, and does it meet the specs, or something more hidden, like the type of backing that you put in the shower to make sure that you know grab bars and so on can be easily installed for accessibility. Did somebody actually go back there and, you know, hey, before that drywall got put on, somebody checked it to make sure the backer board was fine? That's part of the challenge sometimes with even good intentions, and I operate from the premise that everybody has good intentions, but then sometimes operationalizing it is an issue. You know, I know I need to exercise, but do I exercise? You know. And any other thoughts? Any suggestions as to how to address affordability and availability of housing? I understand that there are issues with the cost of land downtown. So land is cheaper on the outskirts, but there are transportation issues with the bus routes, the frequency of bus routes. There are bus routes going to those areas, but sometimes the frequency is not as the same as it is from, you know, getting to the mall to downtown. So any thoughts on how some of those things can be addressed, and incentives and any more money is a good one. I mean, are you exhausting all the sources that are out there? I don't know if you have this problem, but I know for a lot of municipalities, there's always the challenge of them meeting expenditure deadlines, and money rolls over year after year after year in some programs, even state programs. And I've worked with state programs where we were the deadline to expend money was April, and you know a check was cut for $250,000, and we had to spend it. So guess what we did? We bought computers for residents of the neighborhoods. You know, I ask your forgiveness, but that I wasn't the only one who made the decision. But I'm saying that sometimes there are funding resources out there, and are we maximizing those funding resources? Are we? Because money rolls over a lot. This may not be the case in Missoula or Missoula County, but in a lot of other places, in Detroit, I know. I mean, some of you may have seen the 30 million or whatever that 300 million that went to Detroit. Some of that was old money, that hadn't been spent. So are we maximizing this? Yeah. Any particular experience?
Michael Moore from Reaching Home. So, Christopher, I just wanted to make you aware, we just recently enacted a 10-year plan to end homelessness
right.
per some of HUD's requirements.
Mm-hmm.
So we're fair housing is an issue for us, but lop off the fair, and that's the bigger issue for us,
Mm-hmm.
is just housing in general. So when you identify affordable housing as an impediment to fair housing, it certainly is that, but it's an impediment to housing at all, because we in this community, we lack sufficient housing. As Patty mentioned, we have about a 3% vacancy rate. We have a university here. We have a lot of students in some of the lower income housing that we could conceivably use for housing homeless people or low income people. But we also, this community, you talk about using available funds, we're pretty damn good at it. And we act more, particularly when money comes into the state, Missoula acts quickly. And sometimes the state is angry at us because we did act so quickly and got money that they may have gotten. So we're doing a good job maximizing the resources that we have. The problem is when HUD cuts back on money for this, or they cut back on vouchers, or we get sequestered. We have 774 rental assistance vouchers here. We're going to lose 30 to 35 of them because of the sequester. Every one of those things is an impediment to housing in general. So I just wanted to make you aware of the fact that's another area that Missoula is now endeavoring to make progress on. And as Cindy mentioned, money is often the answer to almost every question. And in this case, it's a legitimately good answer to that question. So thank you.
Yeah, thank you for your input. Do you have foundations here that get involved in community issues around housing
Missoula has, and this is a true fact, the largest number of nonprofit organizations per capita in the country.
Okay.
And we have very few foundations locally or even regionally.
Okay.
But we have a big pool of fish trying to all do good work.
Okay. But are they given grants, or are they the foundations, that is it, are they giving grants, or are they working more strategically in neighborhoods and making commitments to a particular area or a particular neighborhood?
My experience is it's kind of individual projects.
Okay.
Or they have they perceive a need and they will help that organization.
Okay.
But it's still a very rural place in that regard.
Yeah.
Michael Moore, Reaching Home again. The level that they're able to help, it's a substantial amount of money, but it's not a substantial amount of money if you're trying to build 50 units of housing or 100 units of housing. If you are a nonprofit and you need $30,000 to make your program run to maybe provide case management services to 20 families in housing, that's great, and that's great money. And I actually work out of the United Way, and we provide a lot of money to almost every nonprofit who's here in this room and a lot of other ones as well. But the kind of money, the amount of money that we're able to offer is a Band-Aid. Frankly, it's not a solution. And you know, the homelessness effort comes out of this idea that we've Band-Aided long enough, and we need to try to do something bigger than that. The kind of foundations you're talking about, though, and that I've recently been in contact with, are like Enterprise Community or the MacArthur Foundation, that deals not in tens of thousands of dollars, but in tens of millions of dollars. And I've stuck my foot in that pool here just this week, and I'd be anxious to report back to you how it went, but we'll see.
Yeah, and I ask that from, thanks for your input, I ask that from the perspective that in some areas, foundations are being called upon to play a larger role in what happens in neighborhoods and play a more strategic and comprehensive role than just, you know, giving out some checks at the end of each year. But how do they end up leveraging money? In Detroit, part of that $300 million was tied to foundations coming alongside HUD and President Obama's office to bring money into those neighborhoods and those areas, on more of trying to have more of a strategic impact in that. So I you know, wish you well in terms of the engagement, and how do you multiply that engagement with other foundations, because you know they have a brotherhood or a sisterhood. I mean, they belong to the same fraternity, so you may be able to leverage one and move on to the next one and others.
Eileen Sansom, Missoula Aging Services. I don't really have anything new or exciting, but I think all of us sort of realize the demographic shift in terms of the aging of our nation, state, and local communities. And what we see in the folks that we work with are people who are, in some cases, outliving their resources because of the increasing lifespan and longevity, which is a great thing, but if you don't have money for appropriate housing, it just makes life much more difficult. The other thing is just the Montana economy and people who have had to retire on Social Security and not much more for income because they didn't work in a job that had a pension or weren't able to save and put aside money for retirement. And I think all of those things just really underscore the need for more affordable housing. And I know a lot of those folks are making up the waiting lists for Section 8 vouchers.
Right.
And a lot of them don't have time to wait. So
yeah, I think one of the resources that you have here, as I sit here and look at the number of persons who are in this public meeting, and I've done this a lot and worked in a grants management department. This is a good crowd. Typically, you may have one or two people. And as I see the responses to the surveys online, it says that you have a group of engaged persons who and as I've interviewed individual persons, it sounds like you have a group of persons who are passionate about what they do in terms of housing and are engaged. And I don't know if you have anything like an affordable housing task force that could try to capture, all of the ideas that may come from all of you and probably even from outside. For example, is there any Section 811 projects that have been redevelopments that have been done here? Yes, or? Right. Yeah.
The state also just got $2 million in, I think, 811 funds, but they have yet to get a finalized contract with HUD to be able to move forward on developing those newer projects. But they're going to do it in five cities across the state. I think Missoula, Great Falls, Kalispell, Billings, and one other ones. Maybe Butte or Bozeman, I'm not sure.
Okay, that's good. But maybe an affordable housing task force could help to put ideas together and see how do you expand what you have. And I'm sure everybody is familiar with a lot of resources. Are you tapping into all resources? I don't know. Federal Home Loan Bank of, I guess it's Seattle here. Do any of you use that? Okay, yeah. So, how do you maximize all those other sources, and what incentives is the city and the county? What can they provide? I know waiver of building permits is always a bad word, or impact fee credits. I don't know if that's something for existing building or existing structures. You get a credit on the impact fees for that, and to see just how much are you able to use those resources to increase the availability of housing. Any issues around or any examples around areas of discrimination where you feel that your constituents are facing discrimination in finding housing, and what types of discrimination?
I would just say this is Justice Ender with Summit Independent Living Center, and I would just say I've run into kind of an attitudinal barrier. A lot of the older housing units in the center of town, closer to transportation services, maybe aren't accessible or visitable. I've personally gone to places where I've been offering to put up the money to put in ramps, and they haven't allowed me to do that. There were concerns, everything from, well, there might be a sprinkler there to what if someone trips on the ramp? And then they always, a lot of the places own, multiple complexes. And so the general attitude is to refer people to the ones they newly built outside of town where the land was really cheap. And those are more likely to be accessible. They're also not really in Missoula anymore. Mm-hmm. They're way outside. So that was an issue that I've run into. Another thing that happens when you talk about, okay, what percentage of houses need to be visitable or accessible? Well, the trick is if you say, okay, 1 in 7 or this percentage is, well, that's only if those housing units go toward people who, have mobility impairments. Well, as a, if somebody, as a landowner, you can't wait around for somebody to take that spot that has that impediment. So another thing I ran into is I call places all the time, and they would say, oh man, we had some accessible places, but we rented them. And they're not going to open up for 5 years. So.
Good point. Yeah. As I said, the solutions are not all black and white, and they're not sometimes they can be challenging. I know that I've heard on at least 2 occasions the issue of infill, the city's infill policy perhaps being some type of impediment from the perspective especially of persons needing wheelchair ramps in terms of spaces and so on. And we meet with the development services this afternoon, so I'll have a better understanding of the infill policy. But any thoughts on whether the infill policy is a detriment or a facilitator of additional housing? If you're familiar with what the infill the city's infill policy and an accessory unit, has that, is that providing an advantage? Is that a solution that is being used and so on? Any thoughts on that?
The accessory dwelling unit ordinance is a new one.
Yeah.
It was fought contentiously by many neighborhoods. We, in fact, have a tremendous number of accessory dwelling units that are illegal. And so what happens there is, again, landlords are able to charge a lot more for the units that they have that aren't necessarily in compliance with current codes. And we get back to the price piece. And so part of the ADU ordinance was to allow a safe haven that you could come forward and have your illegal unit suddenly become legal. I don't think there's been a rush down to community development services to have everyone do that. And so there's a piece there that really needs to be addressed, whether it's illegal units, unsafe units, lack of visitability, lack of accessibility. It's our private landlords and these individual landlords that you see in a typical college town. That's where somebody with the backbone needs to just decide that we are going to regulate the landlord business. And that is something that has not happened. And I cannot begin to explain why there are folks that say state law prohibits regulating landlords. And it's mind-boggling. It's a business. Everyone else has a business license. So actually, I think that both from a standpoint of affordability, safety, and accessibility, that is something that this community could do and could come forward with that would provide some solutions.
Okay, thank you. The city does not have a rental license process, so you don't require a license. Okay. Well, I know some cities that have it, some don't, but
Eileen Sansom, Missoula Aging Services. I was just going to mention, it reminded me in talking about infill, the transportation issues for seniors when a lot of the developments are on the edge or beyond the edge of the city limits. And if for someone who's trying to give up their car or doesn't feel comfortable driving anymore, I think it's really critical to start looking at infill. And if you look at the facilities that are available for seniors within the community center or the central business district areas, those are the ones that are full with waiting lists, and some of the other ones are just more difficult for people to be able to live there and access their community.
Okay. What is the difference in land prices between the outskirts and in the city? What's per unit or per lot?
I don't think I'm going to touch that with a 10-foot pole, but I think actually the problem isn't so much price as it is availability.
Okay.
There just isn't that much land available once you get into closer to the downtown area. I haven't checked prices lately. I think the lot price in Missoula was really skyrocketing for a while, and it's kind of leveled off a little bit. But it's still a little cheaper in the outskirts of town.
Mm-hmm.
But you have to factor in transportation. I think is probably the biggest barrier at that point, because owning a car can be very expensive.
Right. And my understanding too is that people in some neighborhoods are against infill because they like the idea of the less density. Am I correct on that? Yeah, okay, yeah.
So if I can ask the question regarding transportation, if you've had experience in other cities where counties have actually come to the assistance of individual cities to incorporate a better transportation system so that people can live, say, outside of the city without the city having to annex, to be able to coordinate that transportation as an availability?
Yeah, most larger cities and counties use a regional transportation approach where you have city subsidized bus service, but you have commuter rails that go between cities. Like I've done quite a few of these in Arizona. They have a light rail that goes between the cities, and there is cooperation in terms of funding and so on of transportation, subsidized transportation. The challenge sometimes with public transportation is the times, the frequency. And I'm doing some work in Dallas, and a 20-minute trip. The transportation director said he did it himself. He went on the bus, and a trip that should take him 20 minutes took him an hour and a half, and he had to do a transfer. He couldn't, there was no straight route. So that's the challenge. I spoke with the manager at Mountain Line, and he said that the latest strategic plan of their board has been to reduce the travel time down to twice the normal driving time as opposed to 3 or 4 times, which is typically what it is. But that's the challenge with public transportation. So, how do you get housing closer to employment centers? That's the challenge. Now, do you have height restrictions in terms of anybody knows what those are? I'll find out, but just for the sake of discussion. I guess in residential neighborhoods, I know in some places you can do a 3-story in a residential, 3-4-story in a residential neighborhood. That's not an issue. Yeah. So do you look at, going up? Look at your zoning in terms of, and you may have to incur costs of elevators in those type of structures. Any other barriers to fair housing choice? Any?
I'm going to put Eileen on the spot here, but you're talking about the aging population that we're all part of, but some of us feel it more than others as we're getting fast there. I don't know how many other states, and I'd be curious your take on this, Chris, in terms of age is listed as a state of Montana protected class, as opposed to not a national one. And I was curious for what you see in terms of seniors, in terms of finding housing that's available to them, whether they are facing any discrimination because of that. And Chris, in terms of what you might have seen in other places that you've worked with, whether you see age as being used very much, and if so, what form does that come in?
Not a lot of it. Let me let you answer first.
Yeah, I would say it's probably linked with disability or chronic illness, and there's more of a outward sign of someone who might not be the landlord's ideal in terms of a tenant, but definitely that's an issue, I think, but particularly with chronic illness and disability.
Yeah, I would say I don't see a lot of states including age. I haven't done a review lately to see, but generally discrimination is around disability more so than age. In fact, in some communities, there is one community I'm just wrapping up an AI for, and they have about smaller community. They have about maybe 30 developments, multi-family developments, and about of the ones that are affordable, they are all elderly. Low-income housing tax credits, but they are all for elderly persons, and a lot of the qualified allocation plans give extra points for the elderly in terms of those credits, and sometimes those developments are easier to manage than development with kids and so on, larger families. So that there's a preference there. But the challenge, as I said, is usually around disability. I'm not sure if we have seen a lot of cases of discrimination for and anything else.
So on the other end of the age spectrum, I work with student renters, and a new thing that just really recently in the last couple of months that has come up, a lot of the companies are requiring that if you don't meet the credit requirements to rent a property with them, that you have to have a co-signer that lives in Missoula. So that makes it really hard for anyone who has moved here, who maybe has people that they can rely on that are out of state, which is a lot of students, or anyone who has moved here and doesn't meet those credit requirements, but does have parents or other people that they can rely on, but they now have to live in the city of Missoula, or in the county of Missoula. So it's pretty restrictive, and I was at a meeting today with a lot of the property managers, and it sounds like they're all kind of switching to that new policy as the recommendation from the collections agency they work with.
Yeah. So. Thanks for that. Yeah. That's today. Earlier we had a focus group where someone who works with single mothers with children was having some of those challenges. The requirements for credit requirements, and the medical bills because they have kids and so on. And I know in the past, in better times, banks used to ignore medical collections on your credit report. You could still buy a house with medical collections. Another issue for some of those mothers are, criminal felonies. They have felonies, and some of those are not issues that are discriminatory. I mean, it's not a discrimination issue because it's across the board. But unless it's not across the board, but I think in most cases across the board. The other big challenge one is the requirement that you need to your income needs to be three times the rent or something, which generally a very low income person's rent is more like 50%, and sometimes some cases 60% of their income. So it's going to be challenging to find someone who is able to rent at some of those, with some of those requirements.
Yeah, tagging on to what you just said as well, and going even farther on that spectrum of age, is people who are under 18. You know, we have a problem with homeless youth whose housing choices are limited often to couch surfing or sleeping in cars or whatever. We have a law that you can't, and Cindy will correct me on this if I'm wrong, but you have to be 18 to enter into a contract, and so a lot of times people can't enter into contracts with landlords, and so you end up having young kids essentially in their teens who have no place to go and can't legally rent a place to live. So I don't have an answer for that, but I guess for Michael, maybe even to put it on his radar to make sure that it is, which I'm sure it is already. But that's another problem that we face. I'm sure lots of other communities do as well.
Yeah, definitely. Now, is there a new homeless center being built?
Yeah, there is a new homeless shelter being built, but it's mainly directed at singles. It's not families, and they tend, I think, not really youth at all. So.
Now, did you get much pushback in terms of the building of that center, or that?
Michael Moore, Reaching Home. So we're building the new Poverello Center, but the old Poverello Center is downtown here, just a block from here, and has been in that location for decades. Putting it in a new location, it was quite the Donnybrook. I think the Poverello, enjoys very, substantial popular support. But if you wanted to put it in that, this area or that area, it was like, oh, we love the Poverello, we just don't want it here. But it's going out on the middle in a commercial zoned area that backs up to residential. Within about a couple 100 yards, 100 yards maybe.
Yeah, I saw the sign.
So that neighborhood, they've definitely raised their concerns. And recently, Candace is here, but her organization, which does soup kitchen work and other work with the homeless, is trying to relocate in the same general vicinity. And so the neighborhood that recently got the POV is now feeling like they're being asked to have another one, and that's it's a controversy. So and as to your question about place for younger people to go, we do have Missoula Youth Homes, and they do house youths that in some cases would be homeless but are often just in conflict with their family. But in terms of an actual facility that could house a lot of youths, no, we don't have one. We do have another facility, Mountain Home, Montana, which houses either pregnant teens or young teens and their children. But again, they're limited in scope. I think it's 16, 24 units. 24 for age. Okay. But it's like 15 or 16 places. In any case, you catch my drift.
Okay. Chad, you had a comment?
Michael basically was bringing out the points I was going to bring out, but in addition to that, I would say that we see a great number of people who maybe don't come to our soup kitchen, and maybe they don't visit the POV because those focuses on the exterior seem to present a male presence greater than female presence. But that's not necessarily the truth of matters, and I think that in evaluating our services and evaluating the numbers that we see, we also have to keep in mind the likelihood that a certain segment of the population will or will not come in our doors because of what they perceive us to serve. The majority of the phone calls that we get in our office are for women or women with children, or men and women with children, families or women that call the office rather than come down to our center. And primarily at this point, it's because our center is so small that it's quite frankly intimidating for somebody who's feeling that they are a weaker portion of society, perhaps, if that's their vantage point. Which is why we're trying to move. But I would say that looking into possibilities for decreasing wait lists, for making available short-term housing, that's one of the things that we do as an organization as funding permits. We provide emergency motel shelter for a period of a couple of weeks or so until somebody can get from their desperate situation into some sort of a housing program. That's not something that people see all the time because we don't offer it on site. So looking at that, how many other places are providing options that maybe are not seen because they're not part of an actual facility. They're part of a paperwork trail, perhaps.
Okay, thank you. Just from your experience, do you feel that there is strong awareness of fair housing issues or issues around homelessness, housing for persons with disability among the general population, and even out of your experience of working on that center, did you feel there was some opportunity to educate the public about, what are some of the misperceptions about the typical family with children or persons with disability? Any thoughts on awareness and education of the community in general?
Michael Moore, Reaching Home. There's an educational component to my job, and I think Missoula, like a lot of places, has a stereotype of who homeless people are, and it's unfortunately based on an actual group of the homeless people, which constitutes maybe 10 to 15% of the overall population here, and that seems to be a number that holds fairly constant across the country, which is the guy that's drinking, sitting on the sidewalk, throwing up in the doorway of the really nice Chi-Chi home house. So yeah, we have that, and yet we've done an assessment and study here, and we know who the homeless are in this community, and more than 50% of them are families, and more than 50% of those people have jobs. So part of our job, we haven't done we do a good job. We have a Herculean effort on behalf of homeless people here. There's nobody here who works in homeless service who isn't, giving the metaphysical 110%. But the fact is we haven't told our story very well, and that's something that is part of my job now, is making sure that we do that education component to start to try to break down that stereotype. And we're fortunate to live in a community that is very giving. I mean, this community, if you can show a need, this community will roll out. For God's sake, we have a wooden carousel. I mean, I think if we can build a carousel, we can probably do better by the homeless or by the disabled or whichever community it is. So, but I think your point and what's incumbent on us is doing a better job of selling that story.
Right.
I'm Melissa. I'm with the YWCA, and I work with homeless families in our transitional housing program. And most of them are domestic violence survivors. I guess what I want to share is that I do feel like there needs to be more education around domestic violence and the rights that they have as survivors and as victims, I do find that when they're applying for, let's say, some subsidized housing or more affordable housing, is that many of them have poor rental history or have evictions because of the domestic violence. And the Violence Against Women's Act does have key things in place to for the women to fill out and actually provide to housing. So I do think that is definitely in our community a lack of awareness of the rights of domestic violence survivors and victims.
And are you, the housing authority does take that into consideration and waives that? Okay.
I think it's more like with private
Lender, yeah.
Or even some property management places. I think it can be private and some property management places that might just not be aware that those laws are really in place or how to kind of go about it, I guess. So I think just more education in general around it.
Okay, thank you. I was going through the mayor's newsletter, I think it is, and he, this state of the community, and the University of Montana president is on this, and I both from the perspective of housing and also from what we talked about in terms of resources. And I know this is a college town, and there's a lot of spin-offs from this being a college town. And because it's smaller, the effect may be greater, but a college town does not always necessarily mean that college resources are being spent in the town. I done some work in Cleveland, and there is an initiative where a lot of groups and foundations are working with the Cleveland Clinic and with Case Western University to do what is called educational and eds and meds program, where you try to ensure that business opportunities are created through the university and your major hospitals, because surprisingly or not so surprisingly, some of the services that are provided to some of these institutions are external to the place where they're located. So the question here is that are there any other opportunities for partnerships with the University of Montana? Do you have a large hospital? 2 large hospitals. Are there opportunities, both economic development opportunities, and maybe that's a question the Chamber of Commerce can answer, but are there any opportunities for those institutions to be involved in the development of housing in the community in some sort of partnerships? And I know you have university housing that's concentrated around the university, but there are some economic opportunities beyond that, and possible housing strategies that may be used from that. Not sure exactly what, but there are some models elsewhere, and if you do create, part of the challenge we have had with housing and economic development is which one comes first. Is it housing or is it jobs? Is it economic development? So are there any opportunities? And part of the conversation will be with the Chamber of Commerce in terms of how is the economy going to be affecting the demand and supply and availability of housing. Yeah. Any thoughts on that? I
think the mayor is working with the university. I mean, I've been doing this 20 years, and we've been all trying to work with the university to build more housing, and I think the mayor is kind of on board and is working directly with them, and had a plan to bring so many hundreds of new units to town. We actually have, I think, over 300 new units going in a place currently, which will be great to help alleviate some of the student housing up and down along Russell Street. So the mayor is aware of that opportunity and is trying to bring that in. He's also been behind something called the Missoula Economic Partnership Initiative, and I may have the name a little bit off, but it's something that he's brought in, I believe, both hospitals and other community leaders to invest in kind of developing economic development opportunities in Missoula. We are a small town with two, not just one, but two very state-of-the-art hospitals, and consequently they're both looking for partners other than each other, because we really, as a region, probably can't sustain the level. We have phenomenal health care here. But coming to them for housing as a resource, I've certainly tried over the years. There just isn't a lot there. They both give quite a bit to the community, but as Michael had said earlier, it's 3,000 or 5,000 or 15,000 or this or that. Not as a major development player. I think probably the biggest issue for our hospitals and healthcare providers here is recruitment of qualified staff, and that's huge, and that's foremost on their minds, whether trying to compete with the Portland, Oregons or San Francisco or Seattle, and the wages are probably double in those cities than what is offered somewhere like this. So my experience has been in healthcare, it's about recruitment, and we have a lot of nice places to live if you're coming in at that level. So, but I will say, I think the mayor is really pushing on both those grounds, both with the university to develop more housing and economic development.
Okay.
And then another note on what the university is working on with the mayor. From what I've heard, that seems to not be the effort doesn't seem to be as aggressive right now because of all that building on Russell, and also because enrollment at the university is down. Okay. There's less of a push to build, which is a bit frustrating. And also they were really moving forward with a private partnership with a private company that develops student housing all over the country, and the location for that is now being used for another purpose. So they're really backing off of that, and they had said 1,000 units in 2 years, which was very ambitious. But from what I've heard from university administration, is that they're kind of laying off on those efforts for the short term. So.
Okay. Thank you. Just one other question I have in relation to working with private developers or since you have an abundance of nonprofits, have there been any thoughts to partnerships to, for example, the young lady we spoke to this morning, they have capacity for about 8 more units, but they don't have the funding at this time or the financial capacity to build those units. Is there an opportunity to partner, both with for-profit or not-for-profit developers?
We actually have quite a group of both nonprofit and then tax credit developers who work with nonprofits as well as the housing authority. So partnerships are us. We're pretty good in Missoula about getting together and figuring out how to make it happen.
Okay.
And it is 3:30, so.
Okay. Any final comments? Any final thoughts? As we mentioned, the surveys we will be sending out, and we encourage you to have your constituents fill them out. if you have any questions for me or comments, or if you want to send me your thoughts that could be included, you can probably. I have some cards here, but outside of that, you can send emails to Melissa. Can I throw you under the bus? That
You may. Do you want to give people your email address in case they want to?
Okay.
I can send that email address out to everybody who's here today.
It's, do you have pen and paper? It's ASK, A as in Apple, S as in Sam, K as in King, DEVSOL at bellsouth.net. So it's the three first letters of Ask Development Solutions at bellsouth.net. Okay, and thank you very much for your participation. This was really a good discussion. Thank you.